Okay, so um, where to start? My name is Alana Brunacini. I am a doctor of behavioral health. I've been working in the substance use field for approximately 12 years. The Addicted Brain presentation was born when I was the family coordinator for a drug and alcohol rehabilitation facility. And we noticed when we would do our family weekends and our family workshops that we didn't have a great resource to help parents, spouses, loved ones, friends really understand some of the more behavioral components of addiction. When I first started working in substance use, it was a lot of
Might be a little technical difficulty here. We'll get her back in just a second.
okay, am I back? Sorry, my do not disturb function failed miserably.
Yes,
Okay.
we are back.
Okay. So we wanted to be able to teach families, loved ones, a little bit more about the behavioral components of the addiction and the addiction process. So for anybody who might be familiar with substance use treatment, 12-step and some more old school sort of counseling and treatment methodologies have been common for a really long time. Worst case scenario, we talk about substance use as a moral failing, as people not having enough willpower. We hear a lot of things about quitting cold turkey. And there's just a lot of information to try and sort out and to try and understand from an interdisciplinary perspective, whether someone is on the medical side, whether they're on the mental health side, or if they're on sort of the case management community side. We want to provide as many resources as we can to facilitate somebody who has an addiction issue not having that issue anymore. We want to understand, how do we treat this? How do we help someone manage this disease process? What's the best way to approach it? And how can we have the best results? So being able to have a framework to conceptualize, and it's not perfect, it's still a framework, what's going on with folks with addiction, kind of what happens, how does this start? It gives us a really good place, again, regardless of what realm of the interdisciplinary model we're in, to be able to approach this really robust, problematic condition with a lot more empathy and a lot more accuracy when we're doing treatment. So everything's gonna be on the whiteboard today. We're gonna watch it evolve. I'm gonna start talking about the brain itself. So for our legit medical professionals out there, this is not straight anatomy hardcore. This is basic. So we have a big fat brain. And when we think about basic brain function, we think about the brain in sort of 3 chunks. And we recognize we've got this hind brain in the back here, which is responsible for a lot of our automatic functions. So this is going to be automatic, and a lot of our impulses and our survival drives. It's the oldest part of our brain. It's our reptile brain. This next chunk, we're just going to kind of simply call it the midbrain, which is going to be responsible for stuff that gets a little more complicated, like emotions, memory, and learning. And memory and learning is related to reward and pleasure. The brain likes what the brain likes. And then lastly, we're going to come over here to our frontal lobe. And this is the fanciest human part of our brain, where we have executive functioning. That's us being able to plan. That's us being able to think about complex things like math and architecture. We've got the biggest parts of our personality, and we also have morals and values. So these are the kind of chunks of our brain. And when we think about brain development, we kind of start from kind of birth upwards from a developmental model. Can you guys still see and hear me? Someone is trying to call me.
We can still hear you, we just can't see you.
Okay, I don't know why this is like this today. Okay, are we back? We're back. All right.
Yes.
Do not disturb, it's not working. So, all right, so we got these areas of the brain. And when we think about a healthy brain, we're going to take some things into consideration just about brain function in general. So healthy brains operate under receiving stimulus and information from the environment and then doing something with that stimulus and information. So all of our cells are communicating with each other, making various neural networks. And we have billions of brain cells. So early on, even in utero, but when we think about like little teeny tiny babies, the first sensory exposures they have, the first survival drives that they have, all of these automatic behaviors are going to be around keeping the organism kind of moving and growing and healthy. So we know that we have neural networking, and these little squiggles are basically our brain cells starting to form neural pathways. So babies have a neural pathway for sucking their thumb, which is related to some of the like feeding and nursing. And we start to see things like hand-eye coordination, and we just build all these neural networks. Our fight-flight responses live in here. I'm gonna just make a little note of that because we love talking about fight-flight here in a minute. Our autonomic nervous system that tells us when we're in danger lives back here. So this is a really important part of our brain to have wiring. And little babies, little toddlers, they start playing around. They learn that the oven is hot. They learn that some cats scratch. They learn what it feels like to run. They learn all kinds of stuff. When we think about babies, like babies are so fascinating because they truly know nothing. Their brain is an absolutely empty vessel. So every single exposure and experience they have is like monumental to their baby brain. So we want to take into consideration the human brain. It absorbs everything, good, bad, and indifferent. And it does something with that information that ends up being a neural pathway. It's all related to learning in the interest of keeping the organism just kind of healthy and doing stuff. So we have the beefiest chunk of our development of our hindbrain from about 0 to about 5-ish. Kids start to get pretty complicated with more junk going on in their brain at 5-ish. So we've got 5-ish to about 15-ish for the next chunk of our significant brain development. And this is the stuff that's going to have to do with emotions, memory, and learning in huge ways. If we think about what happens to people, what do they experience in that 10-year window between about 5 and 15? That's like the first time like you really get in trouble and maybe you get yelled at and you're like, ooh, dad gets mad when? Or you make a friend and it's just like, oh my God, I love going on bike rides with my friend. And then you meet all these strangers at school. And then you learn about your like weird cousins that you didn't know. And then like you can start to like hear your parents talk about more serious stuff. Maybe you have your first exposure to death. And it depends on how that stuff's explained to you. It depends on what people say, what you see on TV. Just we're taking in all the sensory information and we're just doing stuff with it. So if I grew up in an environment where I have super kind, super supportive parents, and I go through my first little teenage breakup, and I'm a soup sandwich because I just got all these hormones. This is also hormone town pumping through my body. I'm experiencing everything intensely. I don't know how to handle my feelings. Do I have healthy adults around me that are telling me, like, hey, I love you. I care about you. You're going to get through this. Here, let's go, like, get some sandwiches and sit in the park and help you learn how to process your feelings? Or am I going to have maybe some unsupportive parents that don't even know what's going on in my life? Maybe some pretty low functioning parents that are like, that was a stupid relationship and you're a little slut muffin. Like, okay, like what am I getting exposed to? What's happening as I learn? What I learn as I go through these huge experiences is going to shape how I think and feel about the world. It's creating this huge map. And what else it is doing, it is setting the foundation for our coping skills. So this age right here, this is totally coping skills boot camp, where we have to just figure out, what do I do with anger? What do I do with sadness? This is the emotional roller coaster of how to become a fully functional adult in society. I have to have temper tantrums. I have to have meltdowns and freakouts and then be like, oh, well, there's a better way to handle that. Okay, fine. And then we're just able to cope. We're able to just tolerate society because life is stressful. This is where we really get a fat taste of stress. And like we mentioned with like little babies, that 0 to 5-ish age, it's all brand new. So when we think about how like stressed out like a tween is, and we're like, what does this child have to be stressed out about? Like they don't have a job, they don't have bills, but everything is so hyper intense for them. So they're figuring it out. And we may have some questions come up or go down a rabbit hole about like, what is social media doing to this zone? And that's a fat conversation. So we move through that and we build our coping skills, we build our worldview. And then from about 15-ish to about 26-ish, we start developing our frontal lobe. So this is where our brain starts getting fancy. This is where we really start developing our personality. We really start coming into our own about morals and values. Our higher functioning skills start to show up. So this is also where we see kids performing in high school. We see what their strengths are. We see how they handle, again, some of like the stuff that they got their kind of crash course in. And now they're getting exposed to maybe more real stress or more real world stress that they have to tolerate. This is where we see kids decide like, yo, I read the Communist Manifesto. I'm going to be a communist now, mom. Like, deal with it. And they're just trying to figure out what they think and feel about the world, what their morals and values are. They start to get into a lot of habits that are just part of their personal preference, habits that help them maintain their executive function. This is where someone discovers if they're a get up in the morning and exercise person, or if they're a write brilliant papers deep in the night kind of person. This is where people are probably going to start to experience and experiment with much more serious relationships, both romantically and as far as friendships are concerned, and as far as finding mentors, coaches, guides through the world. So we just do all this wiring. And also being super mindful that it goes into our 20s. So a lot of times when we think about, young folks just like seeming a little naive or a little low functioning, we're just like, well, their brain's not done yet. Like, cut them some slack. Like, they haven't finished like cooking this thing. And it's the most sophisticated, most phenomenal organism like possibly on the planet. What our brain can do is just it's just like beyond. It's crazy. So its ability to heal, its ability to learn what it does, it's just bananas. And so all this networking is going on well into our early adulthood. Part of why our brain takes so long to wire is in this learning process, it can reframe. It can take old information and be like, that information is junk now, let's replace it. It can synthesize information so decision making gets faster and easier. Two things the brain really likes. It likes novelty and it likes efficiency. And if we're gonna make that make a little bit more sense, the brain is lazy. The brain likes to take shortcuts as much as possible. So novelty and efficiency allow for the brain to constantly be learning because we do like stimulation. We do like to have excitement and all these various types of novelty. But we like this efficiency because the maintain the organism, it's going to take the least stressful pathway to anything. So we'll also keep those two ideas in mind, is that the brain likes novelty and efficiency. And it's doing this whole learning process. All of this wiring lets us sort of become people. This is what a healthy brain is doing as we age, as we go through various maturation processes. We're taking in stimulus from the environment, and our brain is just figuring out, what does that mean to me? What do I do with that information? And all of our good behaviors, all of our bad behaviors, all of our various quirks and how we become who we are is just through this process. This is 100% a healthy brain. This is a brain that doesn't necessarily have any kind of traumatic brain injury, doesn't necessarily have a psychiatric imbalance or diagnosis. Like, this is just a regular brain. And that's what we're going to start with. Any questions before we start talking about what goes haywire? Okay, so it's time for the orange marker. This kind of learning memory situation, we're going to talk about that on a scale. So if we had a scale, the orange is kind of light, but we're going to make the scale 0 to 1,000 of what is pleasurable or rewarding to our brain, because our brain likes novelty. A lot of things give us positive neurochemicals. Those are going to be our dopamines, our serotonins, our endorphins. A lot of things give us those positive neurochemicals, and that's the stuff our brain likes. So the things that are the closest to our survival drives are going to have the highest natural, like, brain reward. So when we look at sex, really rich, fatty or sweet foods, and high excitement, those get our brain to about 100. And 100 is sort of the most our brain can naturally have. So somewhere between this 0 and 100, petting a cat might be like a 5, or maybe for someone it's like a 40. Eating a piece of broccoli is probably like a 4. It's not 0 because it's food and the body's like, well, I like eating, so I guess I'll eat this broccoli. For someone, maybe broccoli is 10, like, so we think about the natural things that we can do or that we can put into our body that gets our good feeling chemicals pumping through our brain. So as we go through our learning process and we have moments where we're like, ooh, that got me good feelings pumping through my brain, remember that, because we're going to do that more whenever we can. So kids don't want vegetables. They want ice cream because their little genetic bodies know this is a high fat, high sugar food. Eat that, pack it on, survival of the organism. And it's delicious. There's a reason it tastes delicious to us, is because it has all these goodies that are built for our survival. We can talk about how food and, as we get into drugs, have both suffered the consequences of industrialization and our ability to like make things really potent. When we were like in our most natural form before like mega society, the most delicious thing we could eat would be like a ripe piece of fruit or like a good fatty bit off an animal that we hunted. And like our brains loved that stuff. But we couldn't have it all the time because it wasn't in season or because we didn't manage to catch that thing we wanted to eat. So we weren't able to just massively consume the stuff that was like super delicious to us and super rewarding to us. Similarly, you can't do fun, super stimulating things all day long because there are general kind of boring tasks of just like staying alive, where you have to walk long distances or make sure you're like clean. So we have this natural scale here of about 0 to 100, and humans are going to want to hang out and remember and play around with stuff that's in 0 to 100. There's also stuff that feels bad that we remember really strongly as well. And it's going to give us the opposite effect where it's like, ooh, that hurt. I didn't like that. I avoid that now. So humans are super curious. And as part of like our learning process, like we put a lot of things in our mouths. And over time, we're talking about like early man, we figured out what in our environment could get us high. So you've got early people roaming around and they're like, I'm going to chomp on this leaf. And they're like, when I eat this leaf, I run real fast. So cool. That's like the fast leaf. And when I chomp on this, oh, this happens. And progressively, as we evolved, because our brains are so incredible and we're so good at learning, we're like, what if I take the fast leaf and I burn it? And then we just see what happens. And through centuries of trial and error, we've made a lot of drugs out of stuff in the natural environment because it is natural for us to crave novelty. It's part of how our brain functions to seek out rewards and pleasure. That's not surprising. That's not weird. So as humans get better at playing around with like, ooh, there's stuff in the natural environment that is going to give me more reward or pleasure in a brain chemical way than the ripest piece of fruit I can find, or standing in a beautiful breeze on an ocean shore. Like, it's like, no, like the fast leaves are like way better than standing in a breeze. Are you kidding me? Go eat the fast leaves. So over the years, we start distilling and synthesizing these substances, and we take it from 100 to like 200, and then we take it from like 200 to 500. This is obviously not to scale. So one of the benefits of when we were early playing around with drugs is that you can only get so high. So if you ate too many fast leaves, you'd just barf or you'd pass out. You can't ingest much more than kind of what the basic natural thing is creating. But as we synthesized drugs, we were able to get them more potent and more potent and more potent. So we took this 1,000 scale and like made it go off the board. Like too many like Jeff Bezos status zeros. Like it goes off the board. So the substances that we play around with today have been so synthesized and have been made at such an intense potency. I mean, if we look at something like fentanyl compared to chewing on some leaves, our brain was not designed to go to off the chart. Our brain can kind of max out around 100, where it's like, okay, I'm still healthy. When we start tipping it further and further, we start messing up the balance of what our brain's kind of memory reward learning circuit is. That memory reward learning circuit lives in the center of our brain in an area called the reticular formation. And it's a pretty thick band of neural tissue that exists in the interest of like, hey, let's make these really well-traveled neural networks, because these are the ones that are about the goodies. These are the ones that are about reward. These are the ones that are about pleasure. Again, in a more natural state, this isn't getting overstimulated. This is getting a tolerable amount of stimulus based on what we can handle and what we can squeeze into a day. So this is going to have the 0 to 100 goodies. It's going to have sexual interactions. It's going to have really, really savory and sweet foods. It's going to have things that are particularly stimulating per person, because again, each person has some elements that are unique to them. For someone, jumping out of an airplane is reward pleasure. For someone else, that's horrifying. So we know that there's going to be some biological reward pleasure things, and then there's going to be some very personal individual reward pleasure things. So this is where we start adding drugs to how we conceptualize the development and the functioning of the brain. I think I saw a question pop up in there. Devin, can you read that one for me?
They were just letting us know, or asking if it was being recorded.
Oh, okay. Tis. So first thing to think about is, when does a person start doing drugs? Because where I start doing drugs is going to give me a lot of information about the progression of my brain development. So hopefully nobody starts doing drugs between 0 to 5. However, we do know that there are some instances of babies born to mothers with addictions, or some like really rare, horrific cases of child abuse where we see drugs in kiddos' systems. And what we know is that it affects them in a much more fundamental biological way. So we'll see damage in some of their basic auto functioning, respiratory issues, autoimmune issues, musculoskeletal issues, but that's the part of the brain that's the most vulnerable to substances at that time. We don't see that very often though, but when we see it, it matches the area of the brain that's sort of concentrated there. If we have people start using substances in early adolescence, we start seeing some of this normal brain development become impacted by the substance. So addiction doesn't start the first time you do any drugs. So if I'm like, I don't know, like a freshman, and maybe I have like an older sister who's a senior, and somehow I wind up at some house party, and I think it's cool. I think it's totally cool that like all these like big kids, older kids are like drinking jungle juice, and I like sneak a red Solo cup, and then we're gonna see what happens. So biochemically, whether I personally enjoyed my experience or not, my brain, for the first time in its little brain life, went over 100. So biochemically, my brain went over 100. Maybe I puked my guts out and thought it was horrible, So my brain has this mixed experience where it's just like, ooh, I was embarrassed and barfed, but also over 100. And then we're going to see, does that kiddo use more? Does that kiddo use again? The decisions that teens make are insane because their brains aren't cooked. So if a child, because they're children, chooses to start repeating a use, we know there's a component that's biochemical. Their brain's like, hey, that was rad. But we also know that it's going to be very significantly based on all of these other protective factors in their environment, what their experience was, their own little stuff. So we can't 100% know which kiddos are the most susceptible to use and why some kids can like totally just like be fine, or why some kids will party hard for like a year and then it's like not a big deal. Everyone's biochemistry is a little bit unique. Everybody's risk factors and protective factors are unique. We know kiddos with high ACEs scores have a much higher risk of addiction because their support systems are just garbage. We know that if there's addiction in the families from both a biological and an environmental component, kids are at a higher risk for that. Because if I grow up in a house where I see people use substances all the time, that seems normal to me. If I grow up in a house where what I'm learning is that like when I have a bad day at work, I like wind down with a cocktail, I might not even be seeing, I mean, I might not be seeing people get like wasted. I just have a positive association or a repeated association with substance use. So if we have kids start using substances on a repeat basis and on a continued basis during this like early teens years, we have some pretty significant rehabilitation work to do. Because like we talked about, this is like so fundamental to their coping skills. And when we talked about, you know, like they experience everything so intensely then. So if I've already started like drinking a little bit or like popping pills at like wherever I snatch them from, my brain knows like this stuff is better than cake. This stuff is better than making out with Steve. Like this stuff is great. So if I'm upset, if I don't feel good, if I am confused, my brain's like, honey, baby, like, hello, we know how to feel better. Like, I guess you could deep breathe or you could get high. And I'm a child. I don't understand what's happening to me. I just kind of do stuff. Doesn't make any sense. So we have repeated use. Repeated use leads to tolerance, and tolerance leads to increase, which expands where we actually go from maybe some substance use to substance abuse to actual substance addictions. So if we start having it happen when kiddos are like in this age range, a lot of their fundamental neural networking and their coping skills and how they handle stress is linked to substance use. They don't get the chance to learn coping skills because biochemically the substances replace them. Our brain is lazy. Why would I go talk to an adult and feel all these weird feelings and be embarrassed when I could just like put on a record and go get stoned in my bedroom, leave me alone? It's very logical that this behavior happens. And again, when we think about what kind of environments are people in, what's going on for them. So this can get pretty nasty pretty quick if we have repeated use. If we have someone start using in this age range, similar, you know, we don't have as much backtracking to do, but there's still so much cooking going on. And so we just start to see some of these little connections instead of being about, you know, am I communist? Am I really a communist? Like, I don't know. They're like, I don't care. I'm just, you know what? I'm just going to go get drunk. I'm a party. What's up? And so much of this also isn't super duper conscious. So another fun brain fact is all of the electrochemical activity going on in our brain, all these little nerves talking to each other, all these billions of nerves, is about 80% unconscious and 20% conscious. So, we think we know what's going on in our brain, and we are aware of only about 20% of our brain's activity. So that's something that's also really helpful to keep in mind when we're dealing with any kind of addictive behavior, whether it's substance related or behavioral, like eating disorders or gambling. Folks who struggle with addictions don't wake up in the morning and think, I think I'm gonna rob grandma today. Or like, I think I'm gonna do a really shitty job at work and like, I don't care. That like those aren't conscious, rational thoughts that people are having because they've got this 80% of their brain that's starting to go a little haywire because we've repeatedly exposed it to some stuff that's just too potent for our brain. Our brain's going to lean towards just this high intensity reward. That's just how it was made for survival. So we see addictions start to evolve this way. We see that repeated use of a mind or mood altering substance or repeated engagement of a mind or mood altering behavior causes tolerance and also leads to withdrawal symptoms if we decrease our use. So that's what we look at as addictions. Repeated use getting us to tolerance and withdrawal. So we see the symptomology and the behavioral components of substance use work backwards from the way our brain develops. So when someone first starts using substances and they first start with some of that, like just use, we may see some symptoms in our frontal lobe area. We may see a little more disorganized. We may see maybe they're grumpy. Maybe they're like just real subtle personality shifts. We may see a little shift in morals and values. Maybe this was a person that like very consistently went to church or very consistently volunteered. And we can tell that use has gone from recreational use to something that's a little bit more problematic when we start to see symptomology. So we spent a lot of time at the rehab facilities talking with families about the difference between recreational use and problematic use. And one of the ways we can observe that is, do we see observable symptomology? So outside of someone being intoxicated, are they having negative consequences? Are they engaging in repeated use? Like what's going on? We would have a lot of parents that like they'd catch one of their younger siblings doing some of the typical things we see kids do when they explore substances. And they'd want to be like, oh my God, their older siblings in rehab. This one's starting. Should we put them in rehab? And it's like, no, like probably not. Like you need to spend some more time parenting. And like, we don't necessarily need to throw that kiddo in rehab because they like smoked weed 9 times over their sophomore year. Like not really rehab status. We look at like, how's the rest of them doing? Maybe throw them in some like outpatient counseling. But we really want to start watching for symptomology. So oftentimes our close friends and family may be able to see us have some of these symptoms, and they may say something where it's just like, oh yeah, you've kind of been like scatterbrained lately, or like we missed you at the like food kitchen or like whatever. And in this phase, folks usually aren't super defensive yet. In this phase, folks are usually in a very early stage of some of the progression of addiction, where like they don't feel like they have much of a problem. They like haven't had significant stressors. They might even feel fine because their tolerance and withdrawal hasn't gotten funky yet. So some people might, depending on who's in their life, depending on what kind of conversations they have, notice, I don't feel like myself. Maybe it's I'm drinking too much. Maybe I shouldn't hang out with those people that like offer me Coke at the end of my shift. Um, Also, some of us aren't aware of like just how many drugs are like easily available in the world. I waitressed for years and like just Coke everywhere, just all the time. Like, yeah, well, okay, like the IHOP crew is just like doing Coke in the walk-in fridge. No thanks, guys. Um, or you could be like, let's go. Depends on how you're, what kind of what you're bringing to the table. So if people are in this early stage, obviously this is the easiest stage to treat. It's the easiest stage for people to kind of cut their use without having horrible withdrawal symptoms. They've had the least impact to their actual brain structure. If we if if we're early on, it's a lot easier for us to stop because we have just a little bit of some neural wiring. The longer we use and the more our tolerance goes up and our withdrawal symptomology potential increases, we start to see symptomology that's midbrain symptomology. That's where we see people's emotions get really, really different than what their baseline is. That's where we see people's memory start to get funky, remembering basic tasks, remembering simple past events. And that they're not great at learning new information. So if they are taking classes, they're not retaining information well. If they're in a job and we just changed to a new electronic medical record, we've sat through it 8 times with them, and it's like, no, you just file it here. This is the tab, and they're like, yeah, no, got nothing. So this area is usually where people finally start to seek treatment. This is usually where we see people either being low-key forced into treatment or where we see people kind of really feeling the negative effects of their use disorder. So they've already got some of these symptoms going on. They're starting to have some of these symptoms going on. This is also the progression where we maybe start to see some criminal behavior. Just because a lot of drugs are expensive, a lot of drugs are hard to get. The way it works is that in order to obtain substances after a certain point, you may have to engage in illegal activity. If you started on prescription opiates because they were in your cabinet and you happen to start to develop an addiction, we see a lot of people switch from prescription opiates, whether they boosted them from a family member or whether they had their like a legit chronic injury. And if addiction develops, if someone's not going to prescribe for them anymore, if they don't, they're their tolerance and withdrawal is going up, they're going to find a way to manage what's happening as far as their cravings are concerned in whatever way works for them. As the disease progression increases, again, we may see criminal behavior. We may see some of the more stereotyped addict behavior. So people taking things from family members, people not being able to maintain employment, people having really turbulent relationships. Because as the brain just does more and more drugs more and more frequently, our neural pathways are legit just focused on the acquisition of these super potent substances. And that tolerance and withdrawal can really activate our fight flight. So I'm starting to develop an addiction. It's really taking priority. So these chemical substances, I put them in my body, I feel really awesome, but they start to wear off. And as they start to wear off, I don't feel very good. That's the byproduct of the chemical process. And so if I don't feel very good and my brain has gotten this really skewed perspective on what's going to be soothing to it, what's going to be pleasurable to it, every time I start to feel bad, whether it's from actually coming down from substances or having some kind of social consequence, my best option to feel better is going to be more drugs, because taking a walk, eating a piece of cake, calling a friend isn't going to get me anywhere close to what my brain now needs to actually feel calm and to actually feel pleasure, because I rewired it. I broke the system. So this is the problem. This is the problem that people have when this is also the area where we see a lot of defensiveness to treatment. So we come to people and we're like, hey, like your life is a train wreck. We got to talk about this. We got to do something about it. You know, you have been taking stuff from family, you lost your job, you're like low-key homeless. Like, come on, like what are we doing here? And people are gonna be like, yeah, like no, like don't take my drugs. And again, this 80-20, as far as their brain is concerned, it's pretty logical to not want to give up that substance. But their brain's starting to get pretty messy. They're not making real logical decisions. We've abandoned ship from frontal lobe, good executive functioning, good decision making, maybe 6 or 12 months ago, if this addiction's been going on for a while. So it can be really hard, again, depending on when someone started using, depending on how severe their addiction is. You know, we hear stories about people having interventions, and we hear stories about people, you know, like their loved ones tell them they're taking them to, you know, a special pain management doctor, and it's actually just rehab. And, you know, so when we see people get forced into these treatment scenarios, it's mostly because for very sort of like folks are going to resist that treatment. On the other side, we'll see people that can totally recognize, like, oh my God, I feel like crap. This is totally bad for me. I don't want to do this. And they get into a program, they go seek help. But the second they start to crash and the second they start to detox, they just can't. They're like, it feels too crappy. Historically, most treatment has been abstinence only. We've been really hard on folks in recovery because we call them drug seeking and all this different stuff, where it's like, if we recognize that they're going through a biological detox process, they're not going to stay in treatment unless we slowly get their tolerance and withdrawal managed. We need to taper and titrate medications to keep people engaged in treatment. The whole reason opiates became such a big deal is because there was pharmacological stuff, industry aside, you know, we wanted to take pain seriously. We knew that if people were in excruciating pain, that they didn't have great chances of recovery. So when we have folks that are in that detox process, when we have folks that are in that early recovery process, they're in a lot of pain. They don't feel good. They feel like crap. Their thinking is messy. They can't trust themselves. They feel like people are judging them and attacking them. They don't have any coping skills without their drugs. So we take away people's drugs and we put them in these environments where we're like, okay, you need to go to all these 12-step meetings, and you need to go to all these doctor's appointments, and you need to go like keep this job. And we put tons and tons and tons of stress on people who we know can't handle stress. And it's not that they can't handle stress because they have weak moral characters. They can't handle stress because they do not have either the ever existing neural networking to cope with stress, or their current neural pathways for stress management are so low substance use or whatever the behavioral repetition is. So what we have found is that treatment that recognizes folks need time to recover, because basically the brain can totally rewire itself. the brain can 100% turn back on whatever old neural networks it had. And then if maybe it didn't learn coping skills because our person started using really young, it can learn new ones. And in a lot of rehabilitation facilities, some people need rehab. Some people, their coping skills, their stress management, combined with maybe an actual mental health diagnosis, they need a ton of support. And they're really structured environments because repetition is how we build neural networks. Repetition is how we're able to get people to habituate certain behaviors and to break some of their old cycles. Other things that are really helpful for people are things that are really novel and meaningful. So in treatment settings, we found tons of repetition is helpful, and then experiences that our folks feel are really emotionally powerful. So in a lot of rehabilitation facilities or in a lot of treatment programs, we use EMDR, we use equine therapy, we use hypnosis, we use a lot of therapy techniques that give people a lot of like novel emotional bang for their buck, because trying to take a pure like CBT logic route is just really quite annoying to the brain. The brain's like, yes, negative thoughts, blah, 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 cool. It does make sense that I go to work on time. Please stop talking to me, because they're stressed, they're overstimulated. So we have people repeat behaviors, and we just really have people try and experience like various emotionally powerful things. We really try and build relationships. Healthy relationships are huge in how we feel coping skills and how we feel supported. So when people go through any kind of treatment, whether they just start small with like some outpatient services, whether they choose to use sort of a hybrid like MAT group situation, whether they just do 12-step, whether they find themselves in a more classic rehabilitation model, what we're looking for is for people to be able to experience positive novelty, to be able to experience some repetition that lets us rewire or wire healthy coping skills for stress, new positive experiences, new pleasures and rewards. A lot of people, if we take that like judgy moral route, we're very shaming to addicts. So we make this recovery process like pretty hardcore, where everything is like kind of low-key punishment, where it's like, you earned this, you have to work hard. And like, well, duh, everybody has to work hard, like this is America. But like what we have found is that if we don't create some kind of reward pleasure system for folks in recovery, there's no way they stay engaged in treatment. So we have to find ways to make the process somewhat rewarding and pleasurable, or else they will bounce. If it is just like steel on steel, you're a bad person, of course they're not going to stay. One, because that's just completely not how we would treat any human who has an illness, but also their brain ain't going to play that game. So we also know that when we're able to kind of get a gauge on where someone's at in their addiction, and we place them in the treatment that's appropriate for their symptoms, they do better. So I mentioned earlier, if we throw someone into like hardcore 6-month rehab and they don't really need that, it's not going to be good for them. If we put someone in 12-step groups where they need a hardcore 6-month rehab, it's not going to be good for them. So having mental health agencies, public health agencies, interdisciplinary clinics that are able to do a substance use assessment on folks who are looking for some treatment and services is huge for us to just be able to honestly tell a person like, hey, based on some legit assessment tools, like this is your recommended level of care. And are we able to offer that to you? Do we have community partners that are able to offer that to you? Some communities don't have a ton of resources. Some communities try and like hodgepodge stuff together as best they can. Some communities have grants and robust resources. Sometimes the community has a bad reputation. Like here in Maricopa County in Arizona, we have this huge, well-funded like crisis substance use agency, but people hate it. They totally hate, and like they offer all the good stuff you're supposed to offer, but we'll be like, yeah, you want to go down to, you know, the downtown center, and like, and they're like, nope, absolutely not. I'm gonna go sleep under a bridge instead. I'm like, okay. We also know that when we look at a scale of folks with addictions, because there is some stigma and because we do have people with different lifestyles, addictions isn't always just our population that winds up homeless. It's not always our population that fills that very stereotyped like requiem for a dream kind of image we have. There are folks going to work that have addiction issues. There are folks that are, you know, surprisingly high functioning. Alcohol is hands down the deadliest drug in our community. And opiates are nasty and people OD on fentanyl all the time. But our domestic violence, our auto accidents, our suicides, like alcohol is nasty, and that's the one that's legal. And a lot of people can be functional alcoholics. Oh my God. God, like try telling someone like, oh, I can't have a toast at my daughter's wedding. Not for me. It's that one's in all of my experience, like the hardest to work with. And it has nothing to do with how potent one drug is compared to another. A lot of people will ask questions like, is meth worse than heroin? Or, you know, is this drug worse than this drug? When it comes to worse for one drug or another, all we're really looking at is potency and lethality. So what makes certain opiates more dangerous than like cannabis is your risk for overdose. One isn't necessarily more addictive than the other. There's a slight increase of addiction risk the stronger a substance is, but there's no guarantee. We have way more people who are chronic users of not super potent drugs than we do of people who are chronic users of phenomenally potent drugs. The brain also, the consequences of drug use are pretty crappy. So for a lot of the population doesn't become addicted because their brain has a good balance of coping skills where it's just like, yeah, that, like, sure, I got super high and that was like pretty cool, but like then I was like out of commission for 4 days, or I was puking my guts out, and they're able to have some other coping skills kind of come in and help them get through whatever as far as like their experience. So that's sort of, again, are like super fundamental addicted brain 101. Healthy brains are very susceptible to addiction. We're sort of biologically vulnerable to addiction because we like that novelty, because we like things to be easy and efficient. When we started making drugs that were more potent than what our brain was sort of naturally wired to handle, we started blowing the fuses, essentially. The brain is totally healable. The brain does a lot better healing if we get those substances out of the brain. Are people ever able to use drugs again? Sure. Some people are able to have really great outcomes with just harm reduction. Some people are able to just cut back. The more severe an addiction was, however, the more we do see that abstinence is just the most effective or long-term MAT type of treatments. So that's like the basic package. I know we were scheduled for an hour and a half, so we do have time for questions. We can go down little side tangents, whether it's about addiction and mental health, whether it's about behavioral addictions like gambling or eating disorders, general questions, whatever. So we've got good time left.
let's see, we did get a question here in the chat. When
Okay.
looking at addiction to substances, do the same reactions and effects seen when it is from a non-substance vice like social media or technology?
So is basically the same thing happening in the brain with something like social media as with something. So kind of. We need a lot more research. So social media and like social media usage like it gets a lot of hate and gets a lot of shade. So we've got a camp of people that are like, this is destroying America's youth. And then we've got a camp of people that are like, get over yourselves. This is technology changing. People thought TV was going to kill us. So what we know so far is that the most important thing about social media is type. So if someone is on social media all day long doing really like happy, nice things, they're fine. If they're like watching cat videos and like messaging their grams and like talking to their friends about like kind, good, age appropriate things, we notice no significant issues in brain function, in anxiety. If they're on there like doom scrolling and bullying and like looking at like gruesome, just soul crushing things, that constant stream of content is pretty significantly impactful. We also notice that for sort of our like our 15-ish to 26-ish age range, that's where they develop a lot of their like sense of self. And we can go down sort of like a vanity self-esteem rabbit hole as well, that we know is pretty toxic for people. But it's not an addiction the same way. It's like, oh yeah, like, you know, I got a lot of likes for a certain selfie. But it is functioning in a more complex way because there's a social component and like an interpersonal component that we don't totally understand. And the pace at which it works and the frequency at which it works is also something that we don't totally understand. So it has its risks, but it is not guaranteed bad. It looks like the research is trending that the risks kind of outweigh the benefits because it's just such a monstrous, unregulated entity. What we are hopeful for, especially with young adults and kiddos, is that similarly with any kind of like, here's a risk to your wellness, do you have protective factors? Do you have healthy adults that help you build coping skills, build self-esteem, disengage from those devices occasionally? So that is something that we're sort of learning the similarities and differences of. It does, so some social media usage will spike the reticular formation for sure.
So I do have a question. Yeah. So with aggression and type of addiction, so that midbrain, the emotion part of it, is that kind of when like that comes out into the person, is when they have
For
the
sure.
aggression, is when their addiction starts earlier?
For sure. So we look at two things when we're dealing with aggression and addiction. We look at level of intoxication. So we actually primarily see aggression for folks who are actively intoxicated, because whatever's going on with whatever substance they're using, particularly if it's an upper. We see aggression most commonly in folks who are on uppers because they're just like, yes, and their hindbrain is like fight, flight, fight, let's do this. So they're just super aggressive. They're amped up. Their whole nervous system is like, chow. So we see a lot of aggression there. Also, like they're not logical. So if they're just like chilling and they're like totally toasted and just like rage high, and someone looks at them funny, nobody looked at them funny, but they thought someone looked at them funny, and they're hyper stimulated. So that's where we see some aggression, is actively intoxicated folks on uppers. And then we see aggression when folks have an established addiction and their addiction is being challenged, or they are kind of kicking into withdrawal of some kind a little bit. And so they're starting to get hypersensitive. They're starting to not be able to cope with stressors. They're starting to feel really stressed out. And we'll see that aggression show up as a defense mechanism. So as we see stress, we see it primarily in males, just because aggressive behavior is kind of more socially tolerated from dudes. But we see it in both genders. But so as people start to come down and their withdrawal symptoms start to show up, we see some of that more aggressive behavior. That's a fabo question though, because what it lets us express is that addiction itself it doesn't make you an angry person. It doesn't make you an aggressive person. Those aggressive behaviors, 9 times out of 10, are related to something that's happening with your level of intoxication or your withdrawal. So when that person is totally normal, baseline, not all messed up, they're probably not aggressive at all. But that aggression is part of the mess that's going on with their emotion regulation, their stress, their coping, that sort of process. And then aggression and substance use is something that's really scary for people to try and manage. It's scary for people to try and deal with. I loved getting my clinical training wheels in substance use because group is like my favorite. And like those groups get like a little intense because we kind of got to challenge people and we kind of got to be like, nah, say something's going to make you angry today, and help them feel that feeling and help them move through it and be like, yo, I know right now you are so angry, but it's because your brain isn't making any happy chemicals. Like your brain cannot make happy chemicals right now because we blew all your fuses with drugs. So we have to rebuild it. And right now you're pissed. I'm like, I'm not pissed that you're pissed. We're just going to work through this. And I'm going to make you breathe. And you're going to want to punch me in the face. And that's okay. Because after that, we're going to give you like maybe some cake, anything that's going to just like make it a little bit more rewarding and a little bit more pleasurable that you just played ball with us. So if we're going to work with folks in a substance use population, we need to expect a little bit of that aggression, and we need to be prepared that it's like, whoa, this is just like a impulse. So they're not a jerk. They're not coming, like it's not personal. So how can we keep in mind that's not appropriate? We can't behave this way, but also give them some, we're not rewarding necessarily the aggressive behavior. We're rewarding someone choosing to engage with the process so they can stop being aggressive.
Let's see. I don't know if you covered this earlier or not, but is there a point of no return when the brain can't heal anymore?
Sure. So there are definitely some instances where we have some kind of permanent brain damage. Some of that comes from what particular substance we're using. We actually see the most permanent brain damage with inhalants. So if we've got folks huffing different types of horrible garbage, it actually will destroy frontal lobe brain cells. And that can get people into some pretty unfortunate situations where maybe they can low function in society, but we're not necessarily going to see them high function in society again. So inhalants can do some pretty nasty things to our brain chemistry. And then we'll see methamphetamines occasionally because meth is made with so much garbage. Like meth is made out of like Drano and like biohazard and stuff. And that will also do some brain damage. And we see with certain like totally synthetic stimulants that they will cause psychosis that seems to be pretty permanent. So we will have someone that their repeated use and their chronic use of just junk drugs will cause some cellular damage that gets them stuck in like a low grade psychotic state. Again, can they mellow out? Can we work on that with therapy? We can get some progress made. Meth psychosis is pretty rare to be permanent. A good rule of thumb is like the more natural a drug started, the better off someone's brain is going to be. So weed doesn't do anything to people's brains. Like it's surprisingly like harmless to the brain. They can get too much of it in their system and go a little bananas because they've just been high for too long, but we don't see any long-term neural damage from it. Cocaine, surprisingly, super clean drug. Once they detox, not a lot of long-term damage. Good opiates, especially like real natural opiates, totally fine. Like as we start getting into super synthetics and then like junk drugs, that's when we start seeing some more actual damage, because instead of putting a a natural substance that's become potent into our brains, we're actually putting poison into our brains. And so points of no return, other things that people may run into is, especially for alcoholism, we'll see some permanent brain damage. We see Wernicke-Korsakoff syndrome or wet brain, where the blood-brain barrier is just permanently impacted. Just too much drugs went in there. We see that after years of use. But the most common point of no return we see is actually overdose, where the amount of substances that the respiratory or cardiovascular system can handle is just, it just taps out. But the brain itself is like insanely healable as long as we don't like just crash the respiratory and cardiovascular systems. The brain bounces back pretty impressively. It'll grow whole new little chunks. I mean, like it's bananas what it can do with the right opportunities to grow. I saw another one pop up.
Yes, we got one more. So this might be a different form of addiction. So the term weekend warriors. So they go out and party every weekend, but they're a very high functioning during the week. Is that a different form of addiction, or is that not even addiction at all?
Well, so we're going to look at the same thing, where we're going to look at age, we're going to look at coping skills, we're going to look at symptomology. If you've got a 24-year-old who can rage all weekend, they're doing coke, they're maybe playing around with some E, they're going to dance clubs, they're drinking, they're doing shots, they're putting their liver through the ringer, you know, like they're hurting their bod, but they drink a ton of water, their youthful body just pushes it all out. They take a nice long nap, they eat a fat ass cheeseburger, and then they are back to work. Like, would I want to maybe kind of check in on that person every once in a while? Would I maybe be curious about like, what's the deal with the benders? Absolutely. Would I qualify them as an addict? Not necessarily. However, we do see folks that like they go on, like they have that weekend warrior, like bender behavior, and it's really hard. Like their symptoms are sneaky. Their symptoms are super sneaky. And so their like baseline throughout the week where they're normal is actually kind of crappy. But compared to just how toasted they get on the weekends, they're able to function. But so some of those people, if they weren't doing what they were doing on the weekends, like they would be incredibly more functional in their relationships. They would have way less stress. They might be, you know, avoiding developing some chronic health issues. We didn't even go down the rabbit hole of chronic health issues that also come hand in hand with substance use. But they definitely give us some chronic health issues, which taps into this chunk of the brain too. So that's the other thing with addictions. And when we think about like the diseased or the addicted brain model, and for anyone who's like familiar with or has access to a DSM, In the DSM-5, we sort of stopped diagnosing addiction as much as we tried to talk about, is someone using or abusing substances, and is that moderate, is that mild, moderate, or severe? Because moderate use is a different animal than severe abuse. We would want to look at various criteria. So like, are our weekend warriors getting arrested, but they pay their fines because they have good money, or like they have like, you know, someone that helps them? Like, are they able to kind of hide their symptomology until there's like a point of no return? We also see that that weekend warrior stuff doesn't really work past our 30s. Like once we start pushing like 35, 40, like you just can't, your body can't do it. Like we're too hungover. There's just there's not enough like vitamin B bags in the world for us to sustain that behavior on an aging body.
See, I got another one coming in. This was kind of back a question or two ago. What is a normal time frame on the brain function to return to normal once it's able to?
So, without drugs in it, if we are dealing with someone that had severe substance abuse, where like we're going all the way to homeless, but like severe, the brain bounces back to a pretty surprising, like, oh my God, there's like a person in there, in about 4 months. And then the brain bounces back to manageable everyday stress coping in about a year. So the window between kind of coming back to your senses is surprisingly short. You know, we get people sobered up pretty quick. And that's also where we lose people in treatment, where it's like drugs are out of their system, they're feeling great, they remember their grandma's birthday, like they're like, yeah, I'm better. And it's just like, oh no, baby cat, you are not better. Because although we fleshed you out, you feel so much better. Like we haven't rewired your brain. Like the thickness of these junkie neural networks is still so significant when it comes to actual stress. So then we have to look into how much stress is the person under. So if I'm trying to help a person recover while their life is crazy stressful, it's just going to take longer and I'm going to have a lower success rate. If I'm trying to help a person recover where they have tons of support and they're given the space they need, they're going to recover faster and they're going to have a higher chance of successful recovery. It's really hard to keep reminding someone who feels great that their brain is still a little bit of a pickle. And that's something we have to do really graciously and really empathetically without making someone feel horrible about the fact that like, you make terrible decisions, you're not ready. We really have to work with people about like, hey man, like we have to take like your brain's vulnerability to stress super seriously. It's not you. And we want to like be there with you every step of the way to be like, I loved running like the outpatient groups after they got out of rehab, because we'd run these huge dating groups and it would just be like, okay, like how was your date? And just like, it's romance and finances is oftentimes what people relapse over because they're overstimulating for folks. It's so stressful. And so we just talk about everything and be like, how did it feel? Like what happened? Was it weird? Like, did you deep breathe? Did you want to punch someone in the face? Did you start getting cravings? Like, what did you do? And we just talk to them to help them kind of relearn their stress and coping. So unfortunately, we don't have a super clean answer for like when. We know that a 28-day detox for someone who has severe addictions ain't doing much. We also know that it's continued care, you know, and I don't think these words have come out of my mouth yet. Like, this is disease management. So it's not like you're an addict and then you're not an addict. I mean, even that word choice isn't helpful, where it's just like, when folks have type 2 diabetes, the way we manage something like that is, you can slip back and forth into these various phases of like, hey man, like your A1Cs aren't great versus you're about to die. And it's all disease management. And that we have to have resources to help people all across as long as they need help for. And then they have to recognize it's not an on-off switch. It is something that we're always going to be working on. If I never had addictions, I'm still going to have horrible things happen to me in my life where I'm just like, whoa, this is the worst thing that's ever happened to me in my life. I didn't know I could be this sad. I didn't know I could be this scared or heartbroken. If I've never had an addiction, my brain has no memory of this crazy psycho number. So a lot of times what we see with folks with addiction and why we want to have so many forever resources for them is that I don't know when your next worst experience is going to be. So we helped you build coping skills for tons of stressors. We helped you build coping skills for tons of everyday stuff. We didn't help you build coping skills for your 4-year-old kid getting hit by a car. Like, of course, if you had a history of addiction and you have an awful event like that, you may want to use. Your brain may revert back to being like, ooh, this is an overwhelming feeling of awfulness. So we recognize that, like, yeah, that's not that person not taking care of themselves or not working good pro. It's just like, yeah, like just something unimaginable that we couldn't have prepared for happened. And now we have to be here to help you with it so you don't get back to whatever your personal worst was. So it's an ongoing thing. It's totally disease management.
It's awesome. I don't have any other questions at the moment.
Sure,
Did
that's
anybody else
totally
want to
fine.
add anything? You can feel free to unmute yourself, and we about have time for about one more question. Don't be shy.
I saw something pop up, but I can't see like what it is. I'm too far away from my phone.
Chelsea says thank you for such a great presentation.
Well, you're welcome. It's like I started doing, obviously in COVID, I started doing these like Zoom, and I made like my little like backyard like classroom situation. But what I have experienced is that it is helpful information for people, regardless of kind of where they work or what their own personal relationship with substances are, or a friend or a loved one. One of the reasons why I make the presentation so casual is that most people have had it touch their lives. So whether they had it touch their life personally, whether they had it touch their lives through a loved one, whether it's through work, it is amazing how many folks have had some kind of exposure to it. And it's terrible how little good, actually useful information is easily accessible. So whether this information is something that people will kind of take back into their home environments, or whether this is information that people will take back into their work environments, if we're able to talk about substance use in a more realistic, in a more casual, and in a more empathetic way, that is huge progress in the general treatment of addiction from like an insurance-based treatment model. But just like, nobody wants to be an addict. Like nobody wants to have these problems. Nobody wants to be sick with anything. And so being able to recognize like, yeah, this is a situation that a lot of complicated factors are how a person got to this place. And whether I'm directly professionally working with someone, or whether I'm trying to have a relationship with someone, whether I myself am in this situation, like there's a lot going on, and it's totally treatable. But we got to call a spade a spade. We got to know what we're dealing with. And like, we have to be nice, like shaming these folks hasn't served us or them. So I love giving this presentation. It's, it is the way it is, so it can be somewhat accessible and memorable. And if people have more questions, if people are interested in more information, my contact stuff is always made available. You can reach out to me for anything substance related. I also love coming out to communities and teaching either the addicted brain itself or anything kind of related, where if someone wants to talk about co-occurring disorders, or if someone wants to talk about a specific population like teens or veterans or something like that, like those are all options that we can absolutely engage in if people are curious. So I just want to thank everyone for showing up. Thank you for your time. I know we got snowed out the first time. I don't know what that's like. It's like 80 here right now in Phoenix. But that is all I have. So thank you so much.
Yes, thank you. It was a great presentation. And you're making us jealous of the weather right now, since it's maybe
It's
still
hot. I'm
snowing right now.
sweating.
I'm like, we're trying to put on coats, but yes, this was awesome. We appreciate your expertise and knowledge. And if anybody has any other questions for her, please feel free to reach out to me. My email is Devin, DEVIN, at wypca.org, and I can send that over to Alana for further follow-up. All right. Well, I hope everybody has a great rest of your day, and we'll not see you later, but hopefully we can have a visit maybe sometime in the near future. Goodbye, everyone.